Hello and welcome to Health Talks, a doctor-led Vodcast. I am Somesh Surana, your host for today. I manage marketing and digital business for HDFC ERGO. What we thought and why we thought of this doctor-led Vodcast. There are so many questions what we want to know about certain diseases. Before we fall ill, we want to know, is there anything that we can do to prevent these diseases? We would want to understand from experts rather than ourselves doing the research. And this is one step where HDFC ERGO, as a customer first organization, thought of doing a doctor led podcast where we invite experts who can talk about certain diseases, what is it that you need to do in case if you fall ill, or what is it that you need to do to prevent so that you don't get those diseases. Here I have an expert, a veteran, Dr. Anita Mathew. She is Director of Internal Medicine and Infectious Diseases at Fortis. Not only that, she's done her intensive training at Thailand. She's been doing this from more than 20 years. And who better than her to talk about vector-borne diseases, which is the theme today that we have selected on. You'll be surprised to know that 17% of the infectious diseases are contributed by vector-borne diseases. And hence we thought this is a very important topic for you to know what is it that you need to do in case if you fall ill because of one of these vector-borne diseases, or if you want to take any preventive measures so that you don't fall ill. Welcome, Dr. Anita. Once again, I would like you to first talk about what you've been doing, and then we get to the questions where people should know what they need to do and if they are suffering from vector-borne diseases.
Thank you so much, and thanks for the kind introduction. It's a pleasure being here. Well, as you said, I'm an infectious disease specialist. I specialize in obviously the same subject as well as internal medicine. I have been in this field for over about 23 years of practice now. I am a professor at Lokmanya Tilak Medical College, which we call as Sion Hospital popularly here. And I'm, of course, the director of the internal medicine in our hospital there in Fortis.
Thank you. Thank you, Dr. Anita. It's a pleasure to have you here.
Thank you.
And I'm sure people will get a lot of information today after this doctor-led podcast by HDFC.
I hope so.
First and foremost, let's just talk about what these vector-borne diseases are, some information about it, because most of the people probably have half-baked information around all of this and they assume certain things. And we just wanted to make sure that they understand what vector-borne diseases are.
So vectors are basically the methods and means by which you land up getting an infection into your system. So when we talk in terms of vectors, these are mosquitoes, these could be ticks, this could be any of these arthropods, which could actually create a problem for your system by coming and biting you. And if they do contain the bug, which can transmit an infection, then that's how you'll end up getting them in humans. So some of these vectors are, we call human as the end of the cycle. So say for example, if I get bitten by a mosquito, I can still transmit a malaria which I have with the help of another vector which will come and bite me, and then so on. You can have a communication between me and another patient in that particular sense. So you can have situation where a particular family would have 5 patients of dengue because the same mosquito has bitten all of them, but in varying severity, depending upon the number of viruses that the first person would have probably got vis-a-vis the one which could be the last person. So he may have an abysmally low dose of a virus, so no symptoms at all.
Right.
So vectors are the means by which you may land up with an infection. It could be anything.
And is there a specific time, climate that increases the chances of having the vector-borne diseases?
So the usual breeding season that we see is peri-monsoon. So during the monsoon, especially after a bad spell of rains, when you have a little spell wherein there is no rains, that's the time point that they breed rapidly. So monsoon and post-monsoon is the usual time frame that we land up seeing vector-borne diseases, especially chikungunya, malaria and dengue, which increase in numbers. One more that I forgot to mention here is Zika.
And exactly on that point, I think you said it so well. That is the time when it increases, and hence we've seen the number of cases that we get as an insurance company of hospitalization at that point in time, especially during monsoon or pre and post monsoon, increases for dengue, chikungunya and malaria. I would want to tell one thing to our listeners, that anywhere, any hospitalization of these diseases can vary between, say, 25,000 to 2 lakh rupees. And that is when insurance come handy. The comprehensive health insurance that you will have will come handy, and it will save you from any of these kind of expenses, unexpected expenses that come in. What I wanted to ask you, doctor, is there is a lot of confusion between these at least three that you spoke about, which is dengue, chikungunya, and malaria. People get confused whether they are suffering from which vector-borne disease. A lot of times I've heard that they will continue to treat for something else while they were suffering from something else. So do you want to touch upon that and what they need to keep in mind?
Unfortunately, all of these infections will obviously cause the usual symptom, which is fever.
Right.
And all of them have another feature, which is fever which comes with shivering. So
Right.
very often you may have all kinds of infection which can come with fever. So to differentiate between one vis-a-vis and another would be very difficult unless and until we are looking at certain salient points, which could sometimes be also a mimic in certain other diseases as well. So most of our malaria patients could either get fever once a day, or they may get it every alternate day. That's one of the patterns that you can have, because you have 4 different variants of malaria as well.
Right.
Similarly, for dengue, you may have innocuous kind of symptom like just cold and cough, or the typical symptoms where you can have pain behind the eye and severe headache and severe body ache followed by rash over a period of time.
Right.
The same would be with chikungunya, but the amount of pains that you would get in your joints will be particularly more as compared to the other 2 that I spoke about. Right. Zika, you may get some kind of joint aches and pains, but it's like any other viral infection that you may see. So the only way that you can really pinpoint and differentiate is by doing investigations which are appropriate and at the right time. So some of the investigations may not turn up positive on day 1.
Right.
So you may miss out on these particular patients. So maybe connecting with your healthcare provider would be something that would be considered as wise after maybe 72 hours or so of fever. I'm not saying that you need to rush to a doc on day 1.
Right.
Sometimes all that you need to do is, do some of the home remedies and having adequate amount of fluids,
Right.
unless and until you have symptoms which are quite severe.
And are these, can this be, if somebody in the family has it, the other person also can get it? Is that a myth that people carry? Do you
No,
want to
in
talk
fact,
about
that's
that?
what I spoke right at the very beginning. It's a mosquito-borne infection.
Exactly.
So the mosquito doesn't, especially the dengue mosquitoes tend to stay within the household. So they are a daytime feeder. So it's quite possible that you may land up getting an infection in the same household.
It could be if the mosquito has bitten both the family members,
Yes.
but the myth that people have that one getting from another is absolutely wrong.
No, it
can't
is
be.
not contagious.
It's not contagious. So I think that is one thing which, and none of the vector-borne disease can be contagious, is something which is very important.
Yes,
that
it isn't.
all our listeners should know that.
Yes.
Also, you already touched upon the climate change, and largely near the monsoon is when this happens. But there is, again, this can happen any given point in time. That also is some myth that people feel that only if it is close to monsoon, then it will be vector-borne disease, else they keep treating it as something else.
So in the month of December, which is certainly nowhere near the rains,
Right.
we still see a surge of dengue.
Right.
So the breeding seasons have changed a bit because of the climate change as well. So we are seeing cases of chikungunya and dengue, unlike in the past, even in the West, which was so far, it's a tropical disease.
Exactly. And ma'am, is it something that a certain segment of people, a certain set of people who probably are have some pre-existing disease, if they have certain ailments, if they have certain other things that they need to keep in mind, is there a segment like a senior citizen? Do you see or have any suggestions that these set of people should be more careful and this is what they need to do so that they can not get infected with vector-borne diseases?
So unfortunately, it's all a bite-related infection. So
Right.
you would expect the same, the precaution or preventive measures.
Right.
So wearing a full sleeve cloth. I'll touch upon this before I talk
Sure.
about your other stuff.
Sure.
So full sleeve clothes, probably using a repellent. There are people who get bitten by mosquito more frequently than others. So maybe these folks who should be using repellents to reduce
Right.
that particular onslaught.
Right.
If you have pots and pans which are quite kept in your house, maybe you'll need to, the receptacle in which your pots have been kept, your flower vase and all of that, those should be cleaned.
Clean.
right? So any pots, any pans, anything that you have which is containing water would be a potential storage for a dengue kind of a vector.
Exactly.
But stagnant water, dirty water, gutters, these are your usual area where you have a breeding ground for malaria, malarial vector. So these are the things that we can probably do within the community to kind of reduce the onslaught. As far as the extremes of ages are concerned, both the extremes, when you say that's too young and too old, they will have a immune system which is depleting, what we call in medical parlance as immunosenescence.
Right.
So you're just not growing old physically, you're also growing old within your immune system. So you're going to be more prone for them. And besides that, anyone who's a diabetic, who's a hypertensive, people with kidney-related diseases, liver diseases, they will never have a normal immune system, even if it is very well controlled.
Right.
So these are the ones who probably will have a little unpredictable course of the disease.
Right. And is there also any kind of vaccine that is available which people can take as a precautionary measure for any of these vector-borne diseases?
So for malaria and dengue, we do not have vaccines in India as of now. Sure. There are trials which have been ongoing, some of them not very successful, but there are some in the pipeline. So probably we may land up seeing in the near future vaccines which are meant for these two infections. For chikungunya, there is a vaccine, but it's not available in India. It's available in the certain Western countries. Okay. We do have for another vector-borne disease called as JAP-B encephalitis, Japanese B encephalitis. We do have a vaccine available. But these are for people who are going into that endemic zone. India is an endemic zone, though.
Right.
Yes, but there are pockets in India where you will have these patients more as compared to, let's say, the state of Maharashtra, Mumbai, where you are based right now.
Right. So wherever there is more water bodies, wherever there are more...
Maybe jungles and all those areas as well, yeah.
And before I end, ma'am, a lot of people have started doing, reading a lot on their own and doing a treatment on their own. Does that also in some way is something that you have any views on that?
AI is there. So yeah, people do start taking medications without really knowing the implications of each of these, and that's something that we would like people to really come back to us and talk to us about it before they start off with something. Exactly. But I think it's going to take some time for people to have the understanding that what you're doing is probably not right enough. Exactly. Because none of us can become, I'm sure you're into a field which is completely different from mine.
Right.
Just by reading that particular subject, or just by reading it on your chat GPT, I'm not going to be able to replicate what you're doing.
And completely agree. I mean, what we do as an insurance company, and we've been trying to gain mind share of consumers by giving them the right information. So we have an application called Here by HDFC ERGO, where we have an health ecosystem. We put articles, but these are articles from the likes of Mayo Hospital, some of the experts like you, which is being vetted by them, and only right information is being given to the consumer so that they get to know more about it. And that is something which is very important, especially when it comes to your health. You should just not believe anything and everything.
In fact, it should be for all spheres of life. Each one of us have worked in for a certain number of years to be able to be called as an expert or whatever in our fields.
Right.
So I think that particular thing is something that we all need to understand.
On that note, thank you once again
for
being here, Dr. Anita. I think your experience, your vision of what it should be done, and especially what you said on the vaccine and everything, I think that is very important for our viewers to listen and to follow. Once again, thank you for being here.
Thank you so much.
Well, that brings us to the end of this episode of Health Talks, a doctor-led Vodcast. Once again, I would like to thank our guest, Dr. Anita Mathew, for coming here, answering the questions that most of our listeners will really get to learn something from. So once again, thank you, ma'am, for being here. If you have any more questions, feel free to write to us. You can DM at HDFC ERGO GI. Also, if there are any other points, any other topics that you want us to cover, you can share that information with us as well. And we will see you in the next episode of Health Talks very soon. Till then, stay informed, stay healthy, and stay insured.